And our first dog today is the youngest dog that we have on the adoption floor. This is Oliver. He's about 5 months old now, and obviously he's a super cute puppy, and people enjoy puppies, but puppies can be a lot of work. You now have one of those yourself, so you can attest to that. They don't know anything. They're completely reliant on us to teach them the behaviors that we want them to have, to house train them and teach them that it's not okay to chew on the furniture and things like that. So you want to make sure that if you're interested in a dog like Oliver, that you are really committed to providing them with the training that they have. We see dogs coming back fairly recently as today, because people don't want to invest in training them. And it's, whether it's a young dog like Oliver or an older dog like some of the other dogs we'll see on the show today, it's really important to understand that there's going to be some level of training and effort and patience and responsibility involved in adding one of these pets to your household. Oliver is obviously super cute. He did spend quite a while in a foster home, so he did learn how to interact with other dogs, how to be in a home environment. He does still need to work on house training, but as you can see already, he knows sit, and he was giving Sean his paw. So he does have some of those foundations, but still needs a little bit of consistency once he's moving into a home to finish those things out. He is a shepherd mix, very handsome guy, very playful, full of energy. So you're just making sure that you're prepared for all of those things.
Yeah, so you mentioned commitment, and Oliver definitely needs a committed family that's going to adopt him. Why does he need that larger commitment?
That's right. He does need a larger commitment. When Oliver came in, he was not weight bearing on one of his legs. We don't know why, because he was taken to a Good Samaritan. Good Samaritan took him to care, and he just wasn't putting weight on that. So we didn't know whether we were going to have to amputate the leg or not, what was going on. He did get a surgery called an FHO, which was able to save his leg, but because of the recovery, he actually needs a lot of physical therapy. It's stuff that an owner can do at home, but it is a commitment to getting him back to being a dog that's able to play as he would normally do. You do have to watch for certain things. All of that is detailed in his adoption packet, but he's not a dog that can go to a home where you're not committed to doing that physical therapy, because it could be detrimental to him in the end. And it's not something that he's going to have forever, but for the next several weeks, months, things like that, it is going to be a daily commitment. We actually have a chart on his kennel. He's supposed to get that 1 to 2 times a day, that physical therapy. So he definitely needs an owner that's prepared to do that in the short term, so they can enjoy him and he can be healthy and happy and as playful as he wants to be as he ages and becomes an adult. So if you feel like you are committed and have the time and the patience to provide Oliver not only with the basic manners training and things like that he needs, but that physical therapy, you can give us a call to find out more information about Oliver. You can reach us at 301-600-1546.